Understanding Paternal Postpartum Depression, a Hidden Struggle. UAE, the overlooked reality of postpartum depression in fathers. When MH, a resident of Dubai, welcomed his first child, he anticipated a wave of joy and fulfillment. However, the reality was starkly different. He found himself grappling with depressive symptoms that adversely affected his relationships, work, and his connection with his newborn. By the time his baby reached 6 months, MH recognized the need for mental health support as feelings of helplessness and self-criticism escalated. Therapy aimed to assist him in understanding and managing his emotions, while also providing practical, solution-oriented strategies to help him regain his confidence and strengthen his family ties, explained Dr. Ada Suhaimi, a clinical psychologist at Medcare Kamali Clinic. With ongoing support, he gradually regained a sense of control, reconnected with his child, and reported an improved relationship with his partner. The prevalence of paternal postpartum depression. Dr. Mira T. Anto, a specialist obstetrician and gynecologist at International Modern Hospital Dubai, highlights that paternal postpartum depression, PPD, affects approximately 8 to 10% of fathers worldwide, with some research indicating that this figure can soar to 25% during the critical 3 to 6 months following childbirth. Dr. Ida further noted that if a mother is experiencing PPD, the likelihood of the father also facing similar challenges increases by 50%. The silent struggle. Despite its prevalence, many experts agree that PPD in fathers often goes unnoticed. Fathers dealing with depression may show a variety of symptoms, including sadness, anxiety, irritability, and alterations in their eating or sleeping habits, stated Dr. Holly Shannon, a clinical psychologist at Sage Clinics. In the whirlwind of caring for a newborn, these warning signs can easily be overlooked. Some fathers may even hide their struggles, fearing they will be seen as failures or burdens to their families. Dr. Mira corroborated this perspective, explaining that paternal PPD is usually diagnosed using tools like the Edinburgh Postnatal Depression Scale, which has been adapted for men, or through general depression assessments. However, fathers are often not screened for PPD, as many healthcare systems primarily focus on mothers. Typically, fathers are only present during the birth and pediatric checkups, where screening is rare. Most countries lack standardized guidelines for routinely screening fathers for PPD. Dr. Ada elaborated that the roots of this depression stem from a mix of life stressors, identity shifts, and other factors. She emphasized that becoming a parent can significantly alter one's mental state, and similar to mothers, fathers often go undiagnosed or untreated for their conditions. The importance of seeking help. Dr. Mira stressed the necessity for men to engage in conversations with healthcare professionals and seek assistance. They should inquire about mental health screenings or referrals, and utilize support from clinics that specialize in men's mental health or family therapy, she advised. Additionally, there are online platforms in the UAE, such as Takalum and Mindforce DXB, that provide virtual mental health support. She also pointed out that men need to challenge the stigma and cultural norms that often we need reassurance that we are doing well, especially on tough days. Therefore, couples should dedicate time to communicate and truly listen to each other, fostering a sense of connection and support throughout their parenting journey, she concluded.